I just want to express my honor for being here today, and I am thankful for all the organizers for giving me this opportunity. I'll start right away. Our patient is a 44-year-old female presenting, not known to be diabetic or hypertensive, presenting with drowsiness and fatigue of 2-month duration. The patient also complained of abdominal pain and gave a history of dark-colored urine. On examination, there was no organomegaly or lymphadenopathy, and her ultrasound showed bright liver. Her blood chemistry was normal apart from markedly elevated LDH. Her CBC showed moderate normocytic normochromic anemia with increased red cell distribution with also mild leukopenia and thrombocytopenia. Here's the blood film showing marked anisopoikilocytosis, red cell fragments, target cells, and teardrops. Differential count showed absolute neutropenia and relative lymphocytosis, and her reticulocytic count was 2.5%. Her iron study showed normal iron level, decreased total iron binding capacity, and increased ferritin. PNH markers and direct Crohn's were negative. Her hemoglobin electrophoresis revealed an increased A2 level of 6.2%. Here's our patient. To confirm the level of A2, we should do another technique. We did high-performance liquid chromatography, which also revealed high A2 5.6, hemoglobin F 3.4%, and hemoglobin A 91%. So it's our patient, beta thalassemia trait. She has a thalassemic blood picture, elevated hemoglobin A2, but the anemia is moderate. It's normocytic normochromic, not microcytic hyperchromic as expected, and she also has leukopenia and thrombocytopenia. Her clinician requested bone marrow aspirate, which showed megaloblastic changes in the red cell precursors together with giant staph. This is a higher magnification showing the asynchrony between the maturation of the nucleus and the cytoplasm, with the cytoplasm being more mature. This is suggestive of megaloblastic anemia, so we requested B12 and folate, and our patient had severely decreased B12 level with normal folate level. Our patient had severe vitamin B12 deficiency. Our follow-up CBC 1 month after initiation of therapy, her hemoglobin was elevated from 7.6 to 9.2. Now she has microcytosis and hypochromia, and TLC and platelets reverted back to normal. Back to our slide. Now these findings are explained by the B12 the patient had, B12 deficiency. The patient also had high LDH, and we will comment on this in the next slide. Our take-home message: whenever we suspect thalassemia trait, iron deficiency, folate, and B12 deficiency should be excluded before laboratory assessment. High MCV is a hallmark in diagnosis of megaloblastic anemia, but is not essential for the diagnosis, as there may be any other concomitant condition as iron deficiency or is in our case leading to normocytic normochromic anemia. The LDH level is elevated in all hemolytic anemias, but it is the marked elevation should draw our attention to the possibility of B12 deficiency. Levels of LDH more than 3,000 international unit is diagnostic of B12 deficiency. That's all, and thank you.
Thank you. A very interesting case, basic but very interesting. Thank you. But very interesting. Can be missed by if morphology was not checked, and in the back of your mind you don't have that the megaloblastic anemia could change the indices. No one could have got it. Thank you.
They bring the CBC with the patient with normochromic normocytic anemia and the A2, which is high. So we have to confirm that the A2 is already high. When we look at the film, find a thalassemia blood picture, but still the MCV is higher.
But if you look at the red cell histogram, you most probably you'll find
there was a histogram. It was very high RDW. اتفضلي دكتور امان. We finished the case. حد عايز يسأل حاجة؟
No, I'm very proud in the cases كلها ما فيهاش oncology because all the hematologists. Yeah, this is really very.
ما انا جبت لكم
كل سنه وانتم طيبين ويعني بشكركم جدا جميعا وجودكم ويور كونتريبيوشن بتاع اساتذه الكبار. ده يعني one of the causes of success of this conference اذا كان succeeded. في نفس الوقت يمكن كل مره بنقول نفس الكلام ان still thalassemia is a big problem in Egypt, and still screening and prevention is the main goal of this conference, which is actually failed to impact this on the authorities, the Ministry of Health, of the big authorities, and so on. Prevention, still we are looking for more care and treatment and care for our patients. We are looking for. يمكن لو احنا بنبص بره نلاقي الثلاسيميكس كانهم بني عاديين جدا. احنا بنحب جدا ان احنا نبقى زينا زي بره. كل سنه وانتم طيبين. And all of you are invited for the farewell dinner. اتفضلوا.